button them nuts.
What do you say, homie?
As long as you're wearing britches, man, you're good. Okay. Yeah, we'll see. That's hilarious. That's just hilarious. I had the book right here. I'm so glad you brought that up.
That is great. You know me, I'm public safety through and through. Just because I got a piled higher and deeper behind my name doesn't mean that I ain't gonna do what I can. So,
oh my goodness, man.
Hello everyone, I am the Doctor of Disaster, Mark Warnick. I have a PhD in public safety and I'm recognized as a subject matter expert for not one, but 2 universities. Make sure to like and subscribe to the Doctor of Disaster.
welcome to the Doctor of Disaster, and today I've got a guest, Joe Campbell. Joe is, I guess you'd call him a former student or a current student of mine. And Joe is going to share his insights into the shortages that we believe we'll see. Now, Joe, before we get going, can you go ahead and give me a little bit of your background?
Hey, Mark. So yes, I have been involved in public safety for 30 years. Started out doing volunteer rescue, caught the bug, and went on and got my EMT and paramedic cert. I worked on the road for several years, and then I finished up my bachelor's degree and got into law enforcement, working for a state wildlife agency, and I've been with them for the past 22 years. I have recently also started working part-time as a deputy director for our local emergency management agency.
Oh, so with the emergency management agency, you've been a little busy lately.
Yeah, my part-time job has all of a sudden become full-time.
Understood. Anything you want to share about that real quick?
You know, I'm very fortunate to be working in a county who has been utilizing the ICS and the NAMS principles for 15 years. And I've worked on multiple scenes with them. So the EMA director is super knowledgeable. He runs a great EOC. He's a great incident commander. And really the whole county has embraced this incident command system, everything from our mayor to the fire to EMS. So really, anytime that we're using these principles, it's working the way it's designed to. And okay. I'm just very fortunate to be part of that team.
Selfless plug here, but have you found anything that's helped you with ICS NIMS?
I have. There is and we didn't rehearse this, I promise. It's sitting on my desk because it is my go-to reference. And one of the things I'm realizing is yes, I've been involved in public safety for 30 years. I've taken all sorts of ICS classes, and I'm sure folks here in this audience have sat through them. And a lot of times when you sit through them, you spend more time looking at your watch to see what time it is and when you're going to be able to go. And all of that doesn't help you out any when you're in the middle of a crisis. And that's just the reality of things. That's just human nature. But in the middle of a crisis, when you need to get a quick answer, you can get on Google and you can start searching through documents trying to find your answer. Or for me, I like having a couple of good references that I always keep within hand's reach. And this book that you've got, Doc, this emergency incident management system, that's been one that the pages have been turned a lot in the past 4 or 5 weeks.
That warms my heart to know that it's actually being used in the field. Now, let's get on to today's topic. We've seen a lot of shortages in public safety since roughly 2005, 2006. Have you seen them there in your state?
Yes, I've seen them in the state, and especially I live in a rural county. We got a county of about 15,000, and we've got a county-run EMS service. So we got a volunteer fire department. So it's your typical rural America. But one of the things that we see, especially in EMS, is that it's hard for these counties to compete with the bigger cities when it comes to pay. And so it has been a challenge for EMS to keep and retain personnel, just because of just having that struggle to compete with those neighboring counties that offer more money. There's also, and this has been a topic that's been going around a while, as far as just the shortage in EMS, and we're going to continue to see that. Has this COVID crisis, has that made a tough situation even tougher? Absolutely.
Yeah. And do you think that, did you see any shortages in law enforcement or emergency management or firefighting before this?
I think what I've seen is things kind of is kind of an ebbs and tides thing. So there are times to where it seems like that there is a struggle on the LE side. I think right now we've had a recent election within the past year or so, and so we've got a new sheriff in town, and he has attracted a pretty good young group of officers, and they're doing a good job. They're hitting the streets good. They're making some good drug arrests. So at least right now locally, we're doing pretty good, but again, they're ebbs and tides. So, moving forward, we're liable to have shortages, and that's just kind of nature of the beast.
Okay, what about coronavirus? Let's talk about COVID-19. Do you think we're going to see an outflux or an outflow of EMS workers and nurses, doctors, EMTs, EMTs, any of them, any public safety, EMA? Do you think we're going to see people quitting or retiring from work?
What I see, I really see several things, Doc. I see that especially your frontline nurses, your folks at the nursing home, your folks at your hospitals, even your EMS folks. I'm seeing that, right now there's a fight, and they are fighting the fight. But just like any fight, it's going to wear you down. It's going to wear you down mentally. It's going to wear you down physically. And I was talking to the EMS director the other day, because we have got a great system here locally that if we have a suspected COVID patient, either the 911 center or local healthcare clinics or our nursing home is giving our EMS folks heads up to let them know that we've got a possible. So before they even leave the station, they are putting their Tyveks on, they're getting everything buttoned up, getting their mask on. So when they roll out, they're ready to do patient care. And I was talking to the EMS director, and he was just saying, he said, I'm right there with them when they're putting their stuff on. And he said, they're being very serious. They're not joking around when they're putting the stuff on, because they know that, one, they could get sick, and then two, they could pass that on to their family members. So I can't help to imagine the pressure that they're under, during the transport and on their ride back, and when they take the stuff off and go to the house, and just still having that kind of doubt, having that wonder if did I get all that stuff off? Did I not bring any of it home, even all the precautions they take? So, to answer your question, I think we'll see. It worries me, especially in this rural county, because we are so, we're so fragile anyway, as far as our personnel. We just don't have an abundance of them. And we've had a couple of instances where the personnel, especially EMS, And on the correctional side of things, they've had to go off work because of a possible COVID exposure. And so that puts, your workers having to come in and work a 36 or work a 48. And you know how an EMS folks do. They don't have one job. They've got two.
Yep. And, I personally am predicting that we're going to see people retiring and quitting simply because of the stress of all this.
Yes, it is. And what's going to compound that are the fact that right now, what about your EMT students and your paramedic students? Your fire classes, your fire recruit classes. Right now, the State Police Academy doesn't have anybody in training right now, and they're putting they're relaxing some of the requirements for law enforcement as far as their in-service hours and stuff. But at the end of the day, that does not help put trained personnel on the street to either be the law enforcement or fire EMS.
Yeah. And the other thing we're seeing that the universities are shut down. So you've got nurses, you've got doctors, you've got EMTs and paramedics, you've got firefighters and law enforcement and EMA that are not getting training because we're on this isolation right now. And no one thought beyond to what the unintended consequences would be from this. Now that we've already got shortages, we're going to see people quit, and then we're going to see people that can't replace them simply because they've not been trained yet. Your thought?
No, absolutely. I think we've got to be thinking of that. And I think we need to be thinking outside the box. What are our potential, what are and I'm thinking law enforcement right here. That's where my brain is right now. But, because we have a recruit class that's supposed to start in June, at least that's what we've had on the schedule. And that's going to get pushed back at least a month or maybe 2 months. So, as far as what we typically do with those recruits, are we going to need to look at doing something different? And that's one of the things that we're talking to the administration about is, do we need to be thinking about more of, whatever online concept we're doing? Do we need to be looking at the classroom and how to separate them out as best we can? We might actually have to limit the number of recruits that we bring in just because of the accommodations we have. We can't sit, when we had 16 recruits during our last class, they were pretty tight quarters, and I don't see us moving forward being able to do that.
And that's the whole thing of it. People right now are so focused on the response that they aren't looking at what's going to happen when we're in the recovery phase.
Yeah, I think that's part of it. And I still think that there is a lot of misconception amongst folks who really aren't studying what this pandemic response is and what this pandemic's going to look like for the next 6 months, 9 months, 18 months. So it's a little bit of a challenge too when you do talk to some, to some folks who are going to be making those decisions, and sometimes you don't feel like that they're completely aware, got great situational awareness of what all's going on and what this is going to look like moving ahead.
And we all know that situational awareness is a basic concept in order to be able to move forward. So in a safe and efficient manner. Anyway, so thank you so much for your time. I'm going to give you one opportunity to share any story you want about me.
And I've got several stories, but it's the story that sticks out the most to me is that story of when you basically, we're going to laugh about this, when you talked me down from the ledge. And so the backstory, the backstory is that, so I get my bachelor's degree in 97. and I go out and work, and I get this bright idea, and I'll blame some of this on one of my good mentors, Angie Bowen. But I knew Angie was going through the master's program, so I talked to her about it. She planted the seed, and I talked to her about it, and I'm like, yeah, I'll get my master's degree. So the timing happened to where when class started, I was extremely busy with work. I was traveling. I had a road trip to Virginia to do a project. And it was just a horrible time to start a class. And if there's anybody who is in here in your audience who's done a master's program, and all of a sudden you realize that there's something called APA, and there's a certain way that things are supposed to be quoted. And if you've ever taken an online class, there are discussion posts and there's a proficiency. So the learning curve was extremely steep, and I was struggling. I was staying up late in the hotel room, and I was trying to do all this work. And so I was on my way back from Virginia, and I remember I was between Knoxville and Nashville, and I called up Doc, and I'm like, listen, man, I appreciate all this effort, but I'm fixing to be the shortest master's student you've ever had, because I'm done. And he taught me off the ledge. He was like, listen, this is normal. You got to stick through this, So it took about 15 minutes, because I was ready to throw in the towel and said, this is not worth it. Best advice I got was to stick with it. But yeah, that's my story about Doc, was him talking me off the ledge. And it was, nothing. And one of the things I think I've learned through this program is nothing comes easy. Nothing worth working hard for comes easy. And that's what this program has done. It's been a challenge, but it's like I told Doc a couple of weeks ago, if I would have not had this program that I'm in, as far as this master's program, and not so much that program, but just being able to have, Doc to be able to call up and get some advice on. I know for certain that my role in the EMA, or my role in the EOC during this COVID crisis would be much less efficient, and the county that I'm in, we would not be as prepared as we are now if it wasn't for all the efforts of you, Doc, and I appreciate that.
Well, hey, that's just me. But why don't you go ahead and share what program you're in? Because I don't advertise that.
Okay, sure. So I'm going through the Masters in Public Safety at Tennessee Tech University in Cookeville. So it's an online program, and it you can go as fast or as slow as you want. For me, I started out pretty fast, pretty aggressive, taking as many classes as I could. And then as my work, I ended up taking a promotion, and my work responsibilities changed. And because of that, I had to dial back. So I'm taking 2 to 3 classes a year now, and plan to finish up spring of 21. But it's the program is, if just all you got to do is look up Tennessee Tech Masters of Public Safety. If you're interested, look at the program. A lot of great classes. Most of the classes are well done. They build on one another. And again, sometimes when you're in the fight, it's hard to really have an idea of what it's going to look like when it's over with. And that's what I've learned with this program is now that I'm getting towards the end, I can definitely see what all the hard work, all the many nights sitting at the computer punching keys on a keyboard while the family's doing something else, or while my friends are out doing something else. I'm stuck in front of a computer, but it's worth it now.
It helped you in your response?
Oh, no question.
Okay, good. And we give you good critical thinking skills. We work with you the way we need to.
Oh, absolutely. This is one of the things that's impressed me the most is this program here is not a chalk and talk thing. It's not I'm the instructor, I'll tell you what to do, and I'm going to tell you how to do things, and you make notes and you take tests. That's not what this program's about. This program's about giving you the information and then having you research the different parts of the topic put those topics in words and put them on paper and get good feedback. So the communication between the student and you, Doc, has been incredible.
And, you know, you talk about the papers. We don't only do papers. We do memos, we do PowerPoints, we do, what else, Joe?
We do social media releases. We'll do the videos like for social media. We will have take-home assignments. So there are things that when we get out of the program, we have got spreadsheets that have got phone numbers that of different agencies throughout the county. We have got programs. A neat thing about this is this program, it forces you to interact with local emergency management in your area. So, and one of the things that I've seen is the fact that, you know, even as a student, that I'm seeing my EMA manager do things just a little different, or at least take a step back and realize that, man, there's a few other things that I need to be doing in this in EMA that sometimes it just kind of gets pushed to the side because there's so much stuff to do on a daily basis. We can't ever forget the base. We can't ever forget the basics and what's grounded as far as doing as far as our plans and looking at our plans and make sure our plans are appropriate, doing exercises and making sure that those doing your after action reviews after you do your exercises, and again, keep making things better and better.
I'm not going to tell a lot, but you're one of the few that are involved in EMA. The vast majority of who we have is law enforcement and corrections and EMS. So, you know, while he talks about emergency management, there's relatively few in the program, and personally I'd like to get some more because I think emergency management ties everything together cohesively.
Yeah, there's no question that EMA is does that, and I think it, at least where I'm at, I'm in a county that the EMA is well respected in the community, and so they see us as being that, you know, being the center core where everything kind of where it functions from the middle, and then you've got law enforcement and fire and EMS. They're all come together when it's time for that response.
Now, I was going to end this, but I'm going to give you a chance to brag today. You have been the planning section chief, correct, through the COVID-19 for your county?
I have.
What difference has that made when it comes to like feeding or testing, you know, COVID-19 testing, or handing out anything, supplies, stuff like that?
Yeah, so the planning section chief, I think what I've learned the most is how critical it is to be thinking a day down the road, and 7 days down the road, and 21 days down the road, and anticipating issues that may come up. Go ahead and develop a plan. Go ahead and start addressing them. I've made buku plans over the past 6 weeks that we've not had to use, or it just ends up not being a factor. But again, as long as my mind is thinking, as long as I'm constantly, because when you're working on one plan, you inevitably come up with something else and something else and something else that needs to be done or needs to be thought about. One of the great things that I've got with our EOC staff is that we've got a high level of experience in there. Our operations section chief retired from the fire service, who spent a bunch of time on scenes on the wildfire. Our incident commander, the EMA director, has been on, you know, multiple scenes. He comes from an EMS background. So I've not counted up the years as far as the years of knowledge in there, but we've just got a really good group that are able to bounce things off one another. And even though we've got our own position, we don't we don't stay in our lane sometimes. We understand it's okay for us to step out of our lane and give some advice to the operations chief and give some advice to the incident commander. And so that has just worked really well for us. I'm very pleased with how this whole operation's done. I really.
How many people did you test this week? Talk about that briefly.
We worked with the Department of Health, our local health department, for drive-through COVID testing. So we worked with the health department. When they gave us a date that they were ready to do that, we found a place for it, and we came up with our plan to have for things to flow. This happened during the weekday. We originally thought this was going to be on the weekend, and so we had already developed a loose plan based on that. But then when they scheduled it for a weekday, we still kept with our plan, but we had to do some. There was some things we had to work around, such as a few open businesses that we had to worry about traffic-wise. So, but bottom line, we got together, we did a lot of planning, and ended up testing over 200 in a 3-hour time period. It went off, without any major hiccups. You're going to have your little hiccups here or there, but this went rather well. We had a great team. We had plenty of personnel, and again, we using those incident command system principles. Man, it went off rather well.
And the one thing I want to point out is you're a very small county, 15,000 people. You're very limited in the personnel that you have, and very few of the personnel are paid. So what happens is the planning reduces your needs for for more personnel. You learn how to do more with less.
Yeah, that's exactly right. That's exactly right. Everybody knows the role. We had good span of control, and we had 10 personnel from the Department of Health, and we had 20 on the law enforcement, fire, EMS side to make that operation happen.
Great. Joe, thank you so much, buddy. And, for those that don't know, Joe and I, we talk on a regular basis. We started out as instructor and student, and it's morphed into friendship. So, buddy, I thank you so much for sharing this with me.
Thank you, Doc. Thanks for asking.
Okay, talk to you later, bud.
See you, brother.
The Doctor of Disaster is a wholly owned subsidiary of Warnick and Associates Incorporated. Make sure to like and subscribe to the Doctor of Disaster. Hit that button over there.